Having a child is an important part of life and a very meaningful moment. But life changed by childbirth can bring worry, sadness, and depression. Many women complain of temporary sadness, discomfort, irritability, and lethargy after giving birth. However, in some women, the depressed mood lasts for more than 2 weeks, which interferes with daily life, such as caring for a baby, or increases subjective pain. This is called postpartum depression. Postpartum depression, PPD, is a type of mood disorder that can affect women after giving birth. It is estimated that 10 to 20% of women experience PPD, which usually occurs within the first few weeks after giving birth but can occur anytime within the first year. It usually refers to depression and symptoms that worsen within 4 weeks after giving birth. This is due to sudden hormonal changes such as postpartum estrogen and progesterone, and the stress of childbirth and parenting. Mothers may feel anxious or tearful for no reason, have no appetite, experience guilt, and have trouble sleeping at night. Because the symptoms can be mild, while you are experiencing them, in a corner of your head, why am I thinking this? Or, there are many cases of holding hope in the form of maybe it will be okay. There are various models proposed as the cause of postpartum depression, but most point to rapid biological/environmental changes as the cause. For example, before and after childbirth, the hormones in the human body undergo rapid changes, but in the process of finding the normal level, the mood subsides. Be aware that postpartum depression can turn into other forms of depression, such as maternal rejection syndrome. If you endure the period well and receive appropriate help from those around you, there are many cases that improve well without drug treatment. In the case of maternal rejection syndrome, it improves with social contact such as securing psychological support through conversation. All mothers experience mild depression due to the rapid hormonal changes immediately after childbirth and the pain of childbirth. Between 30 and 50% of pregnant women who have had postpartum depression before will experience significant depression again in subsequent pregnancies. Causes include rapid changes in the female hormone system, stress from childbirth itself, pressure on motherhood, and indifference or negative reactions from people around them, including husbands. It is necessary to go to the hospital if caring for a child feels very difficult, if you feel very depressed, if you are accompanied by physiological symptoms such as loss of appetite or insomnia, or if you have suicidal thoughts. Also, even if it's not that severe, if you suspect that you have postpartum depression by yourself or those around you, it's good to go to the hospital and get a diagnosis from a specialist. Here is the postpartum depression self-diagnosis checklist. Check if there are more than one. 1. There's a big difference between good times and bad times, and small things can easily bother me. 2. I tend to get depressed easily and don't feel like talking to people. 3. I lose interest in everything and don't desire anything. 4. Even if I'm invited to do something fun, I don't feel like it and often decline the invitation. 5. I'm not feeling well for some reason, but I don't know the cause. 6. I get sad or cry over small things. 7. No one around me seems to understand me, and I feel lonely and depressed. 8. My emotions are up and down, and I'm not very stable. 9. I'm always nervous because of a vague feeling of uneasiness. 10. I'm upset because it seems like small things that hurt my feelings keep happening one after another. 11. I find it hard to form a connection with children. 12. I have doubts about my ability to take care of a child. 13. I don't feel happy when I look at my child's face. In order to get proper help, it's recommended to consult a doctor or specialist if 11 or more of these apply to you. Within 4 weeks of giving birth, symptoms such as unstable appearance, depressed mood, sadness, severe emotional changes, sudden tears, anxiety, nervousness, and poor concentration appear. You may also feel guilty about yourself and your baby or feel a lot of psychological pressure about parenting. If you have these symptoms, you may be suffering from postpartum depression. The diagnostic criteria for postpartum depression are the same as those for general depression, and it can be diagnosed if depressive symptoms begin after childbirth. Through consultation with a psychiatrist, a history of symptoms is heard and a physical examination is performed. Blood tests to check for anemia or an underactive thyroid may be done to see if another disease is causing the symptoms. Let's explore ways to treat postpartum depression. 1. I try to feel a greater sense of accomplishment that a lovely baby was born rather than a sense of loss that I lost my attractiveness as a woman. 2. Try to get help from people around you as much as possible. 3. Take care of your body and mind by thorough postpartum care. 4. Have more frequent conversations with my husband. 5. Get rid of your fear of parenting and don't think raising a child is too difficult. 6. I often feel the pleasure of trying to have my own time between caring for the child. 7. Consuming omega fatty acids contained in fish and nuts helps prevent and treat depression. 8. Take a bath often with your child to form skinship and maintain a refreshing mood. 9. When you are tired of looking after your child, get help from your mother or babysitter. 10. When you are annoyed with your child, get away from her for a while and listen to quiet music to calm her irritation before you take care of her again. On the other hand, family members and people around them try not to say anything that burdens mothers about childcare. Accept negative emotions with an understanding attitude when mothers are annoyed or angry, and enjoy together so that they can feel pleasure on a daily basis. It is good to recommend suitable activities and help with some of the actual housework and childcare. Since postpartum depression is a medical disease, it is desirable to receive treatment at the Department of Psychiatry. Psychotherapy can be combined with drug therapy. The role of her husband is especially important because the mother feels secure just by having her husband by her side. Her husband should surround her with his love and understanding. Is it okay to take medication for my postpartum depression if I need it? In the past, breastfeeding was not recommended as much as possible because the antidepressant component was delivered to the child through breastfeeding. However, recent results have shown that taking antidepressants while breastfeeding has no significant effect on the baby's health. Rather, women who stopped taking antidepressants because they were concerned about their baby's health stopped breastfeeding within 6 months, while women who continued to take antidepressants succeeded in long-term breastfeeding for more than 6 months. Dr. Luke Grakowicki from the Robinson Institute, University of Adelaide, Australia, who led the study, said, breastfeeding is good for both mother and baby's immune system. The administration of a certain amount of antidepressant to protect against postpartum depression allows the mother's milk to come out slowly and allows regular breastfeeding, giving the best results to both mother and baby. The prognosis of postpartum depression is not known. However, if postpartum depression is not properly treated, symptoms may persist for more than 1 year after childbirth. Long-lasting postpartum depression makes it difficult to properly nurture the baby, adversely affects the baby's growth and development, the formation of the mother-child relationship, and deteriorates family relationships. If postpartum depression is neglected and not helped by those around you, it can adversely affect the mother as well as the baby. This is because postpartum depression can develop and lead to neglect or abuse of the baby. As mentioned above, in addition to lethargy and stagnation, depression may initially show symptoms such as neurosis and increased aggression. If postpartum depression develops, it may reveal hostile and neurotic symptoms. This leads to child neglect or abuse. In extreme cases, postpartum depression can even lead to infanticide. In this video, we looked at postpartum depression. I felt that the most important thing was the encouragement and love of family. If you don't have a family and feel alone, ask anyone for help. There must be angels who care for you and care about you. My message to the postpartum depression patients watching this video: you are doing well and will do well in the future. because you are a lovely mother. If you who are watching this video are acquaintances of postpartum depression patients, do not take postpartum depression lightly, treat it as a disease and take good care of it. Your support and consolation is a great strength to the patient. Thanks for watching.